All right. Hello, everyone, and welcome to the GIE Journal Author Interview Series. I'm Abel Joseph, a GI Fellow at Stanford and a former internal medicine resident at Cleveland Clinic. And with me today is my co-author, Dr. KP Vantanasiri at Mayo Clinic, Rochester. On behalf of our co-authors and our mentors, Dr. Bhatt and Dr. Iyer, we are happy to discuss our recent study on the impact of traction techniques on the vertical margins in T1B esophageal cancer, published in this issue of GIE. Welcome, Dr. KP.
Thank you so much for the introduction, Abel, and it's so great to be here, and I'm super excited.
Awesome. So let's kick off with some background for those watching. So last year, we showed that when ESD is performed for pathologically staged T1B cancer, positive vertical margins were common and associated with an increased risk of recurrence. In that study, we noticed some patients who underwent traction ESD had negative vertical margins despite deep submucosal invasion. So we hypothesized that traction during esophageal ESD may allow for better submucosal exposure and selective dissection in the deep submucosal layer.
That's a very good point, Abel. And in T1B esophageal cancer, the specter of positive vertical margins after ESD is a significant concern. Negative vertical margins could enhance the outcomes of ESD and reduce the risk of recurrence for these patients.
Absolutely, KP. Now, can you share some information about the traction used during ESD?
Definitely. So traction during ESD is a fascinating concept, and it provides better exposure of the submucosa, potentially minimizing the risk of positive vertical margins. The traction group in our study used either traction techniques such as tunneling and pocket creation or traction devices such as the Prodigy traction wire or clip line traction.
I agree. Traction is super cool and definitely useful when used right. It only makes sense, right, given the one-handed nature of endoscopic dissection compared to surgery. All right, so in our study, we investigated whether incorporating traction techniques could indeed make a difference in the outcomes for T1B esophageal cancer patients undergoing ESD.
Totally, and I think collaboration played a very significant role in our research. Abel, can you elaborate on how our collaboration with multiple academic institutions shaped our study?
Yeah, definitely. Collaboration was super crucial, especially since the rare nature of T1B esophageal cancer. And our study included over 10 academic tertiary referral centers, 9 in the United States and 1 in Brazil. I think the diversity and depth of data from these centers added strength and credibility to our findings, and we're extremely grateful to all our collaborators. Now, getting into the meat of the study, the results, KB, could you highlight some of the key findings of our study?
Yes, absolutely. So our analysis of 160 patients revealed that ESD with traction was independently associated with negative vertical margins and R0 resection with odds ratio of 2.25. This suggests that the use of traction techniques might improve resection outcomes in T1B esophageal cancer. Now, Abel, could you share our experience with adverse events in both groups?
Of course. So adverse events was an important question of the study. Of course, with traction ESD, one of the biggest concerns is what is the adverse events? And now 16% of our patients in the entire study population developed adverse events, which is about 27 patients in the entire group. While there were no differences between bleeding and perforation risk between both groups, we did notice a higher stricture rate, especially in the patients who underwent traction ESD. Now, 23% of patients who underwent esophageal ESD using traction, were found to have a stricture, which was managed endoscopically. Now, building on that, Dr. KP, how do you find these findings influencing clinical practice?
Yeah, I can really see the findings from our study influence the current clinical practice in several ways. So the findings suggest that incorporating traction during ESD may increase the likelihood of achieving negative vertical margins, potentially impacting recurrence rates and overall patient prognosis. However, it's important for clinicians to exercise caution and await further confirmation through well-designed prospective studies.
I agree, KP, definitely, especially given the recurrence risk of T1B esophageal cancer. However, I'm really encouraged by the collaborative nature of our study, given the rare population. Our study definitely exemplifies the strength of collective efforts in advancing research, especially in this rare T1B esophageal cancer. Now, engaging in collaborative studies can provide more robust evidence, of course, and contribute to improved patient care. All right, so that's all. Thank you, Dr. KP, for sharing your insights. I'm excited to follow the outcomes of such novel devices and techniques for traction in the future. And to our viewers, stay tuned for more of our work on cutting-edge research, especially in the GI journal in the upcoming issues. Until next time, thank you.
Thank you.